Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. Our topic today is health in all policies. This is a unique approach that convenes diverse community partners to consider how their work influences health and how collaborative efforts can improve health while advancing other goals. I'd like to continue our discussion on health in all policies by introducing my next guest, Ms. Erica Padilla-Chavez, Management Analyst 3 in the Planning, Evaluation, and Policy Unit at the Monterey County Health Department. Welcome, Erica, and thank you so much for taking the time to join us today.
Thank you, Emily, for the invitation.
Absolutely. So I've thrown out a few definitions as to what health in all policies is really. It's a very dynamic concept, as we've kind of mentioned. I have a little something I'm going to hold up for the camera. This is just it's an image kind of highlighting all the different parts that go into health and health in all policies. This is something that you also see if you visit the Planning, Evaluation, and Policy Unit's website, which I'll mention later. But I just want to throw that out there for viewers and kind of start off by asking you, what is health in all policies, from your definition, the definition that you use, and why is Monterey County a good fit for it?
Great. Well, first of all, I'm glad that you brought that visual because people will recognize it on our website. A personal interpretation of health in all policies is really a perspective that is community-focused and resident-focused. When we went out to the community, as Krista mentioned in the prior segment around the strategic plan, and we asked them, what do you need to be healthy? They brought up these issues that are not necessarily within the sector of the healthcare system. So transportation and lighting, as the example she gave, came up. And so really the health in all policies perspective is this perspective of understanding that to a person and to a community and to a population, health is rooted in the integration of health across all sectors. And that is what health in all policies is. So I'm glad that you brought that visual because it gives a very good image on this very conceptual understanding of what we're trying to move here in Monterey County. Monterey County's fitting for this for a lot of reasons. One, you have residents that are saying we need to have access to things like transportation in order for us to ensure that we're getting to and from clinics, as an example. We need lighting on our streets in order for us to walk, as another example. We need access to safe parks, as another example. And so clearly you begin to see how the sectors that are responsible for these areas really do have a role to play in shaping the health and the well-being of our communities. Monterey County already has great collaborative partnerships with a lot of these sectors. And perhaps now that residents are saying we need to make sure that health is more of a focus in these sectors, is the time for us as system makers to come together and to ask ourselves, how can we move health more intentionally in the work that we're doing? So Monterey County is primed for that because of the collaborative nature of who we are as systems, and also because the residents embrace and support this movement, if you will.
Yeah, it sounds like it's not, the health department going out to various communities, agencies, organizations saying, this is what we need to do, this is what we need to do. No, the community is telling us.
Exactly.
The community has spoken, so to speak.
Right, and as Krista mentioned, the strategic plan, while there was data involved, really was very intentionally resident and community driven. And for that reason, we as public servants are here to serve the public, and we wanted to make sure that we held to that spirit.
Indeed. I like that. So what is the relationship between the built environment, if you will, and health in all policies?
Okay. So that's a great question. So let's start with defining what built environment means.
Please.
Built environment is all that man-made, human-made infrastructure in a community. So things like parks, access to healthy foods, the nature of our streets, the roads, all of that, all-encompassing is what we call the built environment. And how built environment factors in with HEAP, or health in all policies, is that there's a recognition that in order for us to be healthy, we need to make sure that we have a supporting built environment. So in other words, if I want access to produce, I need to make sure there's access to produce because there's an infrastructure there around the corner perhaps, or not too far away from my house. in order for us to have access to that fresh produce. So the built environment matters. And so there's a very strong correlation between the built environment and health in all policies. And in fact, to a community member, as we asked them in the strategic plan, they get that. They understand that. And that's why they said, if you want me to be healthy, I need access to fruits. If you want me to be healthy, I need access to lighting. And really that it was the impetus for health in all policies is the data coupled with the feedback we got from residents. So the built environment is core in this movement. And that is why bringing the sectors who are responsible in shaping that built environment is critical to the health in all policies movement.
And those sectors are specifically other county departments? Or?
Absolutely. Even within the health department, we're learning how the different bureaus intersect and how we can all work together to shape the built environment for our community, whether it be environmental health, whether it be behavioral health, we all have a role in this. So it starts at home, and we're definitely beginning to do some of that, learning and conceptual understanding. But then, of course, it spans out to the different sectors. So sectors such as a transportation agency, sectors such as your air quality board, sectors such as your planning team, those involved in the county planning, or even at the city level, the city planning department. Public safety is critical as well. Yeah. So the list goes on. And I think the diagram here lists 10 different sectors. But actually, there are other counties that have endeavored to capture other sectors. In Monterey County, we're going to keep it to a minimum to begin with until we get a good understanding of how we can all play a role in making our communities health and safe.
It seems like there could not be an end to who's involved. I mean, we mentioned the all-inclusivity, if you will, in the last segment, and it really seems like the sky is the limit when it comes to this.
Right. It is, Krista mentioned the social determinants of health. And really, it's this understanding that we need to get to the root of why we're seeing poor health. Now, some of it is built environment related. In fact, there's data that shows that a lot of it is built environment related. Some of it is genetic, and we know for that, this approach is not going to be able to necessarily address those areas of concern. But for the areas that we can, we want to make sure that we get to the root cause of what's causing these patterned behaviors in health. And so, that's what we're going to try to do. And we're going to do that through analysis. We have to look at health indicators and then work backwards. Let's start mapping out what potentially is causing this and then look at data to confirm whether or not we're getting to the root of why we're seeing perhaps obesity rates in certain communities. Is it linked to access to fresh fruits and vegetables? Is it linked to safe streets? What is it linked to? Once we determine that, we can start developing strategies, collective strategies across sectors, so that if a city A or city B is working on that, we can try to integrate that across a region. And then you can, over time, begin to see, hopefully, which is the goal, that we begin to see improvements in obesity rates, as an example.
How fascinating.
Do
you like what you're doing? It's exciting,
love it. Can you tell? I'm very excited.
I know you're getting, it's coming off.
This is an innovative approach, and one that has proven to be very successful in other countries of the world, like Australia and Sweden and Ireland. And so it's been tested in other parts of our world. And in the United States, actually, it's beginning to take form. In California, we actually have a health and all policies task force that is comprised of 19 different state departments. Oh. So California actually has been doing some thinking around this as well. And Monterey County, of course, is now endeavoring in that movement, along with other counterparts in the state of California who have already begun that process.
That's nice to hear. It's refreshing to hear. So we can see that there are some differences between this health and all policies approach and other collaborative approaches, but what are the major differences, if you can outline them, between this approach and others?
Great, yeah. One of the key components with health and all policies is systematizing the health and all policies effort long-term, meaning it's not a short-term fix for a particular project. We're going to try to make health just be one of those areas of concerns that we look at when we're designing policies. And it just becomes integrated as a permanent lens in assessing programs and policies long-term.
So it's sustainable in that way.
It's sustainable in that way. And I can tell you that for some counties, they've been able to implement this through inclusion and strategic planning efforts. As an example, they've been able to then weave it down to program design and making sure that whether you're in transportation or whether you're in an area not in healthcare, that you're putting health at the center of your design of your program. Because at the end of the day, whether you're in transportation or whether you're in education, we all are striving to improve the quality of life for the people we serve. So if we make health intentionally a desired outcome, then the goal is that you begin to see a collaborative approach in improving those health conditions over time. So yeah, it's really exciting, and it's somewhat innovative, but you know, to the residents we spoke to, this seems like a natural just way of looking at how we should be working.
From the way it was explained, it seems like it was the first thing, you know, that they alluded to, that they've pretty much said.
Right, and you know, we didn't necessarily do a lot of defining of health with the public. They took it and they knew they were talking about education and they were talking about transportation, so they knew to define health in a broader perspective. Yeah,
and that's one of the key things I think to remember too. We're not talking about are you sick or are you ill? Do you have bruises or, you know, scabs, scars, or you know, or not? It's a collective approach.
That's correct. More of a sociological approach.
And that's what you were going to say. Is this approach based on a model, the
socio-ecological model?
Okay.
Which is really also a fancy way of saying a prevention model.
Okay.
Which really does look at individual behaviors, but then looks at outer circles of influence, such as policy and social determinants like things like education, for example. So it's fancy word for basically a prevention model.
Yeah, and it's a new approach, but it's not. It's based in, you know, old theory.
Absolutely.
Very traditional old theory.
Old theory, and one that is very much connected to the origin of public health. When we go back to the origins of public health was born out of a necessity to solve, you know, if you remember the outbreak of cholera. And so, you know, the field of planning actually was very much integrated with public health back in the early years of our field. So it's funny that we're coming full circle, so to speak.
It seems like it.
Yeah.
So let's see, what is the approach to implementing this in Monterey County?
Great. Borrowing from the collective impact model, you know, there's really 3 stages to implementing what I call is really a movement. The first is making sure that we all have a very thorough understanding of our call to action. And so in order for us to understand that, we need to embark on a process of learning and education. And so this first year, Monterey County Health Department will be coordinating an intentional effort to do just that. Some education and learning with our partners in the various sectors, including our community partners, our nonprofit agencies, to learn more about this framework.
Okay.
What it is and what it is not. And to begin to understand how others in our state and perhaps even across our country, what they're doing to move the needle in this regard. So we're going to be focusing on making sure that we're all understanding of what it is, so that when we move to the second phase, which is the actual identification of strategies, we are all talking the same language. We understand when we say we need X sector to work on this and there's an acceptance of it, that we all understand where we're coming from and why we're moving in this direction. And then finally, the third step is making sure that we implement it, and then of course the evaluation process.
Okay.
And we're years away from getting there, or maybe a year away. It just depends on how fast we move this first year. But I'm looking forward to embarking on that journey of education, which is the focus for the year.
Awesome. So how will we recognize, like, once we've gotten there, or once we've how will we recognize or measure successes and how we're doing along the way or at the end? It seems like it will never end, but
Yeah. Well, the overall success will be measured when we identify which health indicators we want to improve.
Okay.
So if it's obesity, for example, depending on the sectors that will be required to work on that, we will over time see whether or not we're improving in that arena. But in the short term, one of the measures of success will be the receptivity to this concept. So how many people are coming to our trainings? How many people are talking about social determinants? And we'll be able to determine that through our collaborations and the language that we begin to use in understanding these health issues that are affecting our community. So we'll be setting up benchmarks for ensuring that we are measuring those short little wins, what I call, and they're very important when you're moving something this big.
Yes.
So we need to understand it's not like tomorrow we will all wake up and it'll all be better. It's going to take work, but we need to make incremental steps, and we need to celebrate those steps. And so we will be making sure that we set some benchmarks to make sure that we can then demonstrate this is how far we've gotten. This is where we were just a year ago, and this is where we are now. So we're working in the process of developing those benchmarks, and I'm looking forward to perhaps even coming back and reporting on some of those successes.
We'd love that, and I'm sure that you'll make those successes and the progress, available to the community in various formats, perhaps website, or even additional meetings. I see that you're having kind of ongoing meetings, community meetings, and that'll probably continue.
Absolutely, and I believe in the power of communication, and communication can come in various formats. It could be in this TV show, it could be through radio, it could also be with our partners that are engaged in the work that they're doing in communicating the message to their collaborative partners, et cetera. So you'll be hearing a lot more from us, but if you are interested now and you want to learn more about where the county is going, we certainly have a website with a lot of information and very helpful links that can guide individuals who are interested with more detailed information about health and health policies.
Wonderful. We're about out of time. One more quick question though, Erica. How can Monterey County residents and system leaders become more involved?
Great. Well, I'm glad you asked. On that website, there is a link for anybody to go online and to provide us with their contact information so that they can become a part of our email/mail list. We know that some of the residents of our community still depend on the U.S. mail, and that's great. And so we're being mindful of that. So for anybody who's interested, go online, go on the link, and provide us with your information, and we'll be in touch.
Okay, great. Thank you so much.
Thank you.
What an interesting discussion this was. It's really heartwarming to know that these things are going on right here in our own backyard. So for more information, the link that we were mentioning just now, for more information on health and all policies and how you can become involved here in Monterey County, please visit the Planning, Evaluation, and Policy Unit on the web at www.mtyhd.org/PEP. Again, that's www.mtyhd.org/PEP. Right now, we're going to take a short break, but don't go away. We'll be back with more of the Your Health television program in just a moment.